Now, staying with COVID-19 related news, Gauteng Premier David Makhura says residents who've not been vaccinated against COVID-19 are playing a dangerous game. He's urging the unvaccinated to get the jab before this predicted fourth wave later this year. He also revealed that more than 1 million Gauteng residents have not gone back for their second Pfizer COVID-19 jab. What's behind this further hesitancy in the country's most densely populated province then? For more, I'm joined by Dr. Adiel Chikobvu from the Gauteng Health Department. Dr. Chikobvu is the Director, Health Economics and Financing with that department. But more importantly, for the purposes of this conversation, he is the coordinator of the province's vaccination program. Doctor, thank you so much for joining us. A lot of information coming out, numbers being crunched continually around our vaccination numbers to COVID-19. But this information released by the Premier, or spoken about by the Premier today, is one that probably is alarming. I don't know how you feel about it, but the fact that 1 million Gauteng residents, yes, they've gone for their first vaccine, but more importantly, they haven't gone back for their second jab. What are you reading from the information that you're seeing behind that statistic?
Hi, Marcel, and thanks for having me, and good evening to the listeners and the viewers. Yes, the Premier is right. In fact, if I have to give you the actual statistics, currently we actually have 2,483,704 people who have actually taken their Pfizer first dose. And then when you look at the number that has taken the second dose, it's actually 1,319,076. So the difference between those two is actually 1,164,628. And that's the figure that the Premier was referring to. But you still have to unpack that figure in the context of the 42-day period. You recall that between first dose and second dose, there is approximately 42 days that is required. And then when we look at the data, we actually see that, yes, we are approaching, especially if one considers the 20th of August, it's very, very significant because that's when the 18 to 34 age cohort came on board. And today, being the 1st of October, it is actually the 42th day. It's the 42nd day since the 20th of August. So they are within, but we know the Premier is expressing the fear that there is likely to be a high defaulter rate.
Now, have you got information at hand that can tell us in what areas of the province we're seeing this hesitancy for people to come back for that second jab?
Yes, we have actually done a mapping of various areas at district as well as at sub-district level. I don't have that information on me right now, but it is information that is freely available. We are able to share. But we do have it at the aggregate level as opposed to the individual level. So we are targeting specific areas in order to ensure that at least we get all the people to come on board. And I may as well, if you may allow me, talk about the initiatives that we are currently carrying out. You have already alluded to the Vuma Weekend, which was launched today by the President. We also have all SMS members across the Gauteng City region deployed to the ground as part of social mobilization and demand creation and engage communities. And that's where we are getting a lot of information because the communities are indeed expressing fears around a number of issues, including conspiracy theories, and as well as other unfounded scientific explanations and harm that may also be associated with the vaccines. We do have cases of people who have suffered side effects and therefore they are actually scared to come up for the second jab, etc. So the exercise we are carrying out is really assisting us in identifying the issues, some of which are very genuine, which are being raised by the communities on the ground. So our strategy includes intensifying social mobilization through the integrated ward-based battle plans, the ward-based war room programs, door-to-door loud hailing distribution of pamphlets, communicating the message to create appetite towards the vaccine. We also have launched a number of pop-up sites and drive-through sites. Mobile clinics have been deployed in far-to-reach areas. Recently, we have brought on board a very exciting initiative of free Uber rides to vaccination sites. And then, of course, there's the big one where we are in partnerships with NGOs, the private sector, as well as the employers to vaccinate both the staff as well as the family members of the staff. And we hope these efforts will pay dividend in future.
You said earlier that we've gone through the 42-day period from when the 18-plussers would have gone for their first jab. As part of your mobilizations and the interaction that your workers are having on the ground, because it seems like that is getting a lot of information for you, what are we hearing from these younger South Africans who've gone for their first jab? Is it because of perhaps some of them having side effects, a painful arm, and the likes of those side effects that we've heard that some people suffer from the jab? Or is it perhaps, look, I haven't had the time just yet? As we know, young people have lots of things on their plates. Many of them are studying or they have work to do. What are we hearing are some of the reasons for that younger crowd not going back for their second jab?
So what I indicated is, if you do the calculations, today marks 42 days. So we are actually expecting that age cohort to start reporting as of today. So the reasons that we have so far are in fact attributable to the older and the elderly age group, that is the 50 to 59 as well as the 60 and above. They are the ones who have been telling us a number of reasons, including side effects and so on. But as far as your question is concerned on the 18 to 34, today marks the day when they now need to start coming for that second jab.
Now, the Premier was speaking earlier when he was out in Kutsong in the Merofong municipality, and he said they really saw the fact that they've went out and mobilized and got people on the ground at community level, really turned around that area, because the numbers for vaccinations weren't great to start with. But as soon as they really started mobilizing on the ground, we saw people being convinced to come for that jab. You are probably going to have a two-pronged approach now, trying to get more people to go for that first jab, but now you also need resources to go after people who still have to come back for their second jab. Do you have enough resources, both physical, logistical, and human resources, to take that two-pronged approach to this vaccination drive?
Yeah, thanks, Marcel. I think from where we are, if we then have to look at the resources that we have deployed on the ground, compared to the output that we are realizing, we are actually getting lesser of output compared to the resources that we actually have on the ground. We had actually planned for numbers that are much greater than what we are seeing. But you're quite correct, because then in terms of the social mobilization and the demand generation, this becomes then another additional exercise. So there have been a number of initiatives that have actually been launched in order to assist in that regard. We are also grateful to the National Department of Health. We have given us clinical operators who will also be participating. We are anticipating their arrival from Monday next week. So we are not at this stage very much worried about the lack of resources for the level of output that we are seeing. But of course, we always want to ensure that we have as many resources available, just in case then there is a floodgate of participants coming on board. But like I'm indicating, we aren't at a stage where we are really worried about the insufficient resources, including, by the way, the vaccines. We do have sufficient vaccines in stock. So it's more of the planning. I would attribute that to the planning, as well as the support that has been given to us by the National Department of Health, the support led by the Provincial Command Council and the Premier, because we have, for instance, all our community healthcare workers across various departments, sector departments. We have also the private sector that has come on board, and we have partnered in a manner where all resources and all hands are on deck. So, of course, we always need more resources so that we can relieve those that are on the ground. You have healthcare workers who are working some 7 days a week, etc. So the more resources that would get, the better. But we cannot, at this stage, I want to reiterate that point, say we have failed to perform because of the insufficiency of resources. No, not at this stage.
Dr. Chikobvu, how agile are you in terms of being able to set up a spot for vaccinations? I saw on social media earlier today, there's a butcher in Cape Town that decided to make his space, his business available as a vaccination site. And a few nurses came and they set it up as an official vaccination site, and they were able to jab a large number of people, both the staff at this butcher and people who were coming in just to buy their meat for the weekend. How agile is your operation? Even if a bar or a sports club or a butcher or a bakery says, listen, Saturdays are very busy days. We know that you're finding it difficult to get people to turn up at official sites, the clinics, the hospitals and those places that have been set up for vaccination sites. How easy or difficult is it for you to be able to go and set up by somebody who said, come to our bar, we're going to make a nice clean space available to you? What do people need to do to try and make that happen?
Marcel, the good news is we have actually been doing that all along. Perhaps it's not in the public domain, but we've been doing that all along with various partners and companies, etc. Our contact person in that regard is often Saras Naidu, as well as Modiba Motale. And then, of course, what they have to do is we also want to ensure that we target areas around. If it is employers, we also look at the size of the employer, etc., the workforce, etc. But that is an initiative that we have actually been running with for almost 2 to 3 months, if I'm not mistaken. Yeah. And as we speak, I think on Friday we're even at SAB in Vereeniging, etc. So we are very agile, and we really would want to promote that kind of initiative as well. I think in the next couple of days, we'll actually be going to malls, etc. I think you did see, it must have been last month, if I'm not mistaken, where we even went to Maponya Mall in Soweto.
Yes.
So it's something that we embraced a long time ago, and it's part of our strategy, even as we speak to this day.
Well, let's hope you can do even more of that and go where the arms are available. Thank you so much for you and your team and for the work that you continue to do. And best of luck. That's Dr. Adiel Chikobvu from the Gauteng Health Department. He's the Director, Health, Economics and Financing, but most importantly, he's the coordinator of the province's vaccination program.